Welcome to another episode of Raising OKC Kids, Conversations with Metro Family in Oklahoma City. I'm Kirsten Holder, and today we're talking with Dr. Garcia from Dental Depot's Southwestern location in Oklahoma City. Welcome, Dr. Garcia.
Okay, thank you guys for having me.
Yeah, so I'd love to start with some introductions about you. You received your undergrad from Northeastern State University and attended dental school at the University of Oklahoma College of Dentistry. You were born and raised in California with your parents and younger brother, but I've heard that you now consider Oklahoma your home, which we just love to hear. You've
Yeah.
said that your favorite thing about dentistry is being able to help people smile, whether this means you're helping someone feel more confident about themselves or getting someone out of pain. The amount of satisfaction that you get after a hard day's work, knowing that your patient left happy about their smile, is one of the greatest joys one could receive. And I can only imagine
Yeah.
kind of taking your patients through the before and after of that. I'd love to hear a little bit more about the why behind what you do every day.
Yeah. You pretty much hit it right on the spot. Everything that we do in dentistry, it's almost an immediate type of satisfaction. Whenever a person comes into the office in pain, uh, if you're able to take care of them that day, whether it's a root canal or doing a filling or whatever it is, immediately you can see the difference. And so, a lot of that satisfaction, you get right away. A patient presents with an issue and you're able to solve it right away. And so it's something very different from any other type of field of work.
True, definitely. And seeing those smiles and that confidence
Yeah.
booster,
Oh
I'm sure
yeah.
it's so
Oh
great.
yeah. It makes a huge difference. We get patients who come in here with a chipped tooth. Let's say they were at home and brother or sister hit them in the face on accident, or they tripped and a part of their tooth chipped, and being able to fix that right away too. You walk in, and if we have time for it and we can take care of it, it's such a huge difference. And the person shows up stressed out, thinking that at their face because it's chipped, and with them walking out, it looks completely different too. Yeah.
Absolutely. What a fun part of the job. And I'd love to have a little bit more fun with this interview and talk with you about some social media trends we've been seeing about dental hygiene. If anyone's on TikTok or even
Yeah.
watching Instagram Reels, I found a good one that talks about little known brushing mistakes, and we can play
Hmm.
that for you.
Yeah.
For those of you watching on our website, you can see the video playing. And for those of you listening, Dr. Whitney DeFaggio is mentioning how pushing too hard, using bristles that are too hard, or brushing less than 2 minutes can actually be detrimental to your dental hygiene. Dr. Garcia, what would you do, or what do you think about the point she makes in this video? And do you have anything to add that people might not know about dental hygiene?
Yeah. No, just 2 days ago, I had a patient who came in and they told me that they brush like 4 or 5 times a day, and we tell you your whole life that you have to brush your teeth as much as you can every day, but there is a limit to how much you should be doing it. Some people think that you should be brushing super hard and it's going to get rid of all the bacteria. The cavities will go away, but if you're brushing super aggressive, you're brushing really hard, brushing a million times a day, what you could actually do is damage the enamel, which is the outer layer of the tooth. And so you really want to, if it were up to me, I would say brush right when you wake up in the morning. Take care of that bad breath for the rest of the day, and then as you're eating throughout the day, and you're giving that bacteria something to work off of. You want to make sure you're brushing right before you go to bed, so there's nothing in your mouth while you're sleeping. And so I would try to limit it to 2 times a day. Be really gentle. Try to use like a softer bristle toothbrush. Some people think that the harder the better, but all you're gonna do is damage your teeth. Yeah.
Mm. Yeah, we think we're doing a good job, but I guess we don't know it all.
Yeah. Oh yeah.
So another one is about mouthwash. And when I think about using mouthwash, I'm thinking about like just killing all of the unwanted germs in my mouth,
Hmm.
just making it extra clean. But I did see this TikTok video about not using mouthwash with alcohol in it. Can you explain why dentists don't recommend mouthwash with alcohol?
Yeah. Both of them have their pros and cons. They both pretty much do the same thing. When you're swishing it around, the whole purpose is to try to lift up that bacteria so you can spit it out. And the difference between both of them would be, one of them having alcohol. patients who have issues with dry mouth, you don't want to use alcohol. It's just going to make it even worse. There are patients who have issues with substance abuse, drinking and stuff like that. You definitely don't want to use it. There are people who have sore spots in their mouth. That's just going to make it hurt even more. With the non-alcohol version, the biggest difference is, that the alcohol does help a little bit with denaturing or killing some of the bacteria, but when you're involving all these other factors that the alcohol can cause, sometimes it's better just to do the non-alcoholic version. Does pretty much the same thing. Helps you rinse everything out, swish all the bacteria out. Uh, the biggest pro about it though is you get to avoid all those issues that I mentioned a second ago. Yeah, and if I tell my patients all the time too, a dry mouth is a perfect environment for bacteria. Your saliva, a lot of people don't realize is very basic, and you want to have that environment that prevents bacteria from overgrowing, and so it helps calm things down. And if you have a dry mouth, it's just going to make things worse. Yeah.
I like that point too about sores in your mouth because I hate that feeling when you're doing your mouthwash, you didn't know you had a sore in your mouth and now it really hurts.
Yeah, and now you
Put
do
alcohol
exactly.
on it.
Yeah.
Yeah, so that is a great point. Okay, I've got one more video for us, this time from Dr. Rochelle Beebe talking about charcoal products. These are so popular, whether they're in face washes or different kinds of hygiene tools. And there's obviously charcoal toothpaste as well.
Mhm.
Dr. Beebe talks about why charcoal toothpaste is not a desirable option. I'd love to hear if you agree and why and what you'd recommend instead.
Yeah. Uh, I think with charcoal toothpaste, it really, studies have been done, and it's never really been proven that it makes a huge difference. I think it's one of those like placebo effects when you have all this black gunk in your mouth and then you swish it off and now your teeth look white again. You're like, man, it looks so different. And it's just you in your head telling yourself like, yeah, these look way better than before. Um, from the stuff that I do understand with charcoal, it is an abrasive. It's gonna, you know, it sort of works like toothpaste. Toothpaste has stuff in it that is abrasive that's meant to take off any plaque, any bacteria that you've built up. But you can do that with any type of toothpaste too. Um, the bad thing about charcoal, since there hasn't really been very much information released about how well it works, you could be damaging your enamel, and so that's already one downside to using that. And then the second thing too, a lot of people think that charcoal, they attribute it to activated charcoal, which is used whenever people ingest something that's poisonous. People will take charcoal and it helps to try to calm down any of the effects that's going to affect the rest of your body. Well, they think that by using charcoal, it's going to get rid of the stain, get rid of the bacteria, whatever's causing the cavities, which is completely false. It absorbs toxins, but not in the way that you would think when it comes to toothpaste. So, in my opinion, it really doesn't do anything. You could do more harm than good with it. Yeah.
Ugh, a little bit deceiving. I'm really glad you broke that down for us
Yeah.
because, like you said, the so-called placebo effect of kind of seeing
Hmm.
your mouth all dark and then
Really.
wiping it
Yeah.
in, that contrast, you might think you're doing good.
Exactly. Yep.
Yeah. Well, thanks for all that insight and answered questions behind some of the social media videos we've been seeing lately, especially on TikTok.
Mhm.
And I'd love to talk with you more specifically about you and your family now. So, what inspired your family to move from California to Oklahoma?
Um, so uh the biggest reason being just prices in California are crazy high. And my mom growing up, we had rented out for a long time. We always lived in an apartment, and over time, my mom, she always had these dreams of getting a home, owning her own home, and um, it was just something that my dad, he knew prices were a little bit more affordable over here, and one of his friends actually came out to Oklahoma, and they had talked to him and said, hey, the jobs here are great. We need some help. I can get you a job if you want it. All we need you to do is to say yes. And the house market here is booming. The area that where we eventually moved to was Broken Arrow, which is right next to Tulsa. Um, that area was completely brand new. And my dad, I remember there was one summer where he just moved out by himself, came over here while we stayed in California, and he loved it. He loved the scenery here too. You know, comparing where we grew up in California, you have an area that's really, there's buildings everywhere. You hardly ever see trees. And when we first came here, completely different. There's trees everywhere. It's just a different environment. And the biggest reason though was just to answer your question, the biggest reason was just my mom trying to achieve that dream of getting a home one day, and she got it. And I pretty much consider this my home now for sure. Yeah.
That is an awesome story. We that live in Oklahoma don't always associate it with trees too. So it's nice to hear that you appreciate being here because of the greenery, even
It's
even
so
in the
different.
dead of
Yeah.
summer.
Yeah.
Yes, but I just love that about owning the home too. It is Oklahoma
hmm
is a great place to live
Yeah.
for that reason, for sure. And you grew up speaking Spanish, especially at home since your parents didn't speak English. Can you tell
hmm
us, maybe from personal experience, why it's important for patients to have access to bilingual staff? And as I understand it, you're the first dentist who is bilingual. So it
hmm
must be hard to find providers with bilingual dentists.
Yeah. Every time that especially in the office that I work at now, there's a large majority of patients speak Spanish, and you can tell the difference when they finally get to have somebody that they can communicate with in their own language. Um, in Growing up too, I've seen the difference it can make because my mom didn't speak English, and so I always had to be there with her for everything, appointments, whatever it was. I had to be there, and I understand the struggle that somebody could have, um, trying to relay that information that they have in their mind, but they can't really get it across to the doctor as well as they want to. And the patients here, they've told me they're so grateful that they finally have somebody that they can express what's going on to. And you don't have that middle person or middleman trying to figure out what's going on with one person and then trying to explain it to the other person. So I think it really helps with understanding the patient and making them feel more at home. Um, and I've had people tell me that they feel more compassion from somebody who can speak their own language too. So I feel like it makes a huge difference for sure.
I absolutely see that. And
Yeah.
in medical care, if you're not able
Yeah.
to thoroughly communicate why you're
Yeah.
there, that can be really dangerous.
Exactly. Yeah. Explaining certain procedures it can be confusing in your own language. I couldn't imagine trying to explain something in a different language, and people get completely lost for sure.
Yes. And then the care and the
hmm
kind of that you're understanding where someone's coming from because you understand the connotation of what they're telling you in their native language.
Exactly. Yeah.
Mhm. I just love that. I'm sure so many patients are so thankful that you're at that office and able to communicate with them in the way
hmm
that they're most comfortable.
Yeah.
And
Yeah.
so much of going to the dentist is wrapped around how comfortable you feel in office, which for some people is already kind of a hard thing to feel comfortable in a dentist's office. So
Exactly.
besides offering bilingual care, what other ways do you make sure your patients have a comfortable experience?
Uh, just making sure that they understand that, I'll ask them too, like, do you want me to explain what's going on step by step? Do you want me to just do what we're doing? Um, I feel like a lot of people, they get scared because they don't know what's going on. For me, I know everything that I need to know about dentistry. If I go see the dentist, I'm not scared because I know what's going on. And some patients really appreciate it whenever I tell them step by step, this is what we're doing now. This is the next step. This is what to expect. I try to take things pretty slow in that regard just to make sure that they're super comfortable. Um, I give them a way to have an out too. Like let's say if something is stressing them out or if they got to use the restroom, I tell them just lift up your arm and I will stop immediately. Don't worry about me keep going forward with it. Once I see your arm come up, I will stop. Um, Other things too is just asking them about themselves, what's going on, just things like that too, just to make them feel more comfortable, make them feel like they're a part of uh, a family or something bigger too.
I love that. You are clearly a very relational person, and I'm sure that is very valuable in your industry when you're seeing
Yeah.
patients and kind of trying to give them the best medical care, but also make them feel confident and comfortable and kind of in
Hmm.
control. It's so scary when there's somebody in your mouth, like you're saying, you need to raise your hand even to say
Hmm.
to say
Yep.
anything because you can't when there's tools
You
in your
can't.
mouth.
Exactly. Yep.
Yes. Well, awesome. Well, thank you so much, Dr. Garcia. I loved hearing more about your knowledge, but your passion really shines through in what you do, and it's just such a pleasure getting to know you. I appreciate all the insight. For next time I'm scrolling social media, and I'm sure our listeners do too.
Yeah.
And for everyone listening, you can learn more about Dr. Garcia and his practice at www.dentaldepot.net. Once you click Find Your Location, search for Southwest Oklahoma City. Thanks again, and join us next time on Raising OKC Kids.
All right. Thank you guys.